The Ontario government's plan for schools this fall is being met by criticism from teachers' unions and some parents' groups. They say it doesn't do enough to keep everyone safe. Under the plan unveiled yesterday, elementary school children will be back in class full-time under physical distancing rules. They'll be in class cohorts, staying with their groups for recess and lunch, but the class sizes, they won't be reduced. The province is also promising $309 million for PPE, cleaning, and more staff. Parents will be allowed to opt out and keep their children home.
We don't know whether we're going to be exposed to the COVID more or if we'll be okay. We don't know that. So I'd rather be safe than sorry. So if you don't want to go, don't go.
We have some classrooms with 30 students, and to say 1 meter apart, that doesn't work.
Grocery stores, bars, and gyms in this province have more safety protocols in place than our classrooms will.
For high school students in cities and suburban communities with large populations, the plan is different. They will be in school on every other day, alternating between in-class and online learning. All students from grades 4 through 12 must wear a face mask. That's the first in the country, mandatory in Ontario. Younger children won't be required to have one, but it will be encouraged. The first day of school in Ontario is set for September the 8th, which is, of course, the day after Labor Day. And children in Manitoba can expect to be back in the classroom full-time in September as well. But unlike Ontario, they won't be required to wear masks. High schoolers will be back in school full-time, but in schools where there isn't enough space to allow physical distancing rules, they will go to class on alternate days. If schools don't have the space to keep students apart, the plan also allows for students to be grouped into cohorts. Recess and lunch breaks will be staggered to allow for space, obviously, and to avoid crowding. In some schools, it's the teachers who will change classes, not students. Manitoba children are also back in class on September the 8th. So this is the point of departure for our doctor conversation this morning. Dr. Zane Chagla is back with us. Met him not too long ago. Glad to have you back, Dr. Chagla, infectious disease physician at St. Joseph's Healthcare in Hamilton and also an associate professor at McMaster University and the Health Sciences Department. Hello. Morning.
Hi. Thanks for having me.
There is so much interest in the whole question of school reopening that we thought what we'd do today for our conversation, if it's okay with you, is spend time on viewer questions all about different aspects of school reopening. So why don't we jump right in, because we got so many. I would like to start with this one, Dr. Chagla. Well, in fact, the number one topic from parents writing into us and grandparents concern is this bubble. Kids going back to school, what does it do to the bubble? So here's an example from Rochelle. If kids are allowed to return to school full time, what is the risk for parents and grandparents in contracting COVID-19? Can grandparents continue to visit with the family? And we had similar questions from Jane on this. We had another question about this from Tracy and a similar question from some other viewers as well. People are going to see them up on the screen. Variations on a theme, concerned about when the kids go back to school, what happens to the bubble, and do they have to start to reduce perhaps their number of social contacts?
Yeah, so the bubble concept worked really well at this time. If we kind of kept our contacts low, we maintained the physical distancing, we masked in public, then we could maintain those 10 people that we could be very close to, with our typical contact with people. There's no answer of what's going to happen in September. I think we have some positive things going for us in terms of the community rates being very low, which is probably the biggest protective factor for schools. We have, screening for schools. We have at least masking for grade 4 and up. We have physical distancing that's going to be a priority. We have the cleaning. And so the likelihood of something happening is low, but it's not going to be zero. And so people do have to make a risk assessment here. If there are vulnerable people seeing those kids, it might be reasonable for a couple of weeks to hold off, see what happens in the school system, see if rates are starting to go up before they start engaging back. And realistically, if it's not working well, particularly for the younger grades, that bubble concept essentially breaks down as those young kids are then seeing 30 other kids in that sense. So I think, a little bit of caution in the first few weeks is fairly reasonable, especially for people at high risk of complications. It's not great, and it's heartbreaking for some of those families that are finally getting back together. But at the same time, I think, we're going into an experiment where we don't know the outcome. We're taking all the precautions possible, but there's not going to be a zero risk scenario here.
Okay. I want to come back to this idea because you mentioned masks, and I do want to come back to that. I should point out, these are a lot of questions from Ontario residents because of the announcement yesterday, but they're very similar. The themes go right through Manitoba, Nova Scotia, Quebec, up Yukon. These are the questions that parents want to have, and students too. This is a question from Fatima, which is interesting. A student in Ontario wanting to know how schools will catch asymptomatic students. How long would it take to catch asymptomatic students before it's too late and they are infecting multiple other students who then carry it back to their families? So the question there from Fatima to you, Dr. Chagla.
It's a really good question. So at least in Ontario, there is going to be some study into doing random testing amongst high school students, as we know that's probably the biggest group that can transmit similar to adults within the community. In the kid argument, it's a little bit difficult. Now, even in our typical healthcare settings, we're not marching out and testing people asymptomatically. We're really doing defined symptom screening. And we know, looking at the epidemiology, yes, there are people that are asymptomatic that are shedding, but the gross majority of people still have relative symptoms, although they'll shed while they're pre-symptomatic in that sense. Okay. It's almost impossible to go out there and march and test every single kid, especially with some of the higher end tests like nasopharyngeal swabs, where if you've had one done, you probably will never want to have a second one done after that. And so I think it's appropriate that we again maintain that surveillance, make sure that kids are being screened aggressively for symptoms coming in, making sure community rates are low. And if we start seeing a case or two in schools, do what we've been doing in the community in terms of public health outbreaks, that we contact trace, we then do a sweep around the school, we organize, we try to figure out where the transmission came from, and then work from there. Okay. As the technology gets better, there certainly are approaches for asymptomatic testing, but for now, I think we rely on what we've been doing in our communities.
Asymptomatic transmission, one of the reasons we've been getting increasing guidance on wearing masks. And in Ontario, the only province now in the country to make mask wearing mandatory for grades 4 to 12, and then encouraging younger students to wear them as well. Just remind us how effective this is, the latest science on the efficacy of wearing masks in a classroom setting, Dr. Chagla.
Yeah, so the classroom setting isn't as clear. So there's not really been a big trial, just for the reasons that a lot of the classrooms have closed as part of this first response to COVID, and they're really just starting open again. There are some experiences in Southeast Asia where masks have been used and the transmission has been relatively low in those schools. There's other examples in Europe where masks have not been used and there hasn't been that much transmission in those schools. So it's still a moving target, but I do think that's a brave step for the government to say, okay, well, at least for the students that we know approach adulthood in terms of their transmission, we're going to mask them to make sure that they don't transmit. For the younger ones, encouraging them, and for parents, it's a great idea even now to get your kids used to wearing masks. It's going to be the expectation coming up in the fall if you're over grade 4 age. But yeah, the evidence is still not there, and we'll see what happens in the fall.
That's really one of the contentious points, and one causing many questions for parents wherever in the country they are. Tracy, Beth, Jane, and all of our other viewers, excellent questions for Dr. Chagla. We'll look forward to our next visit. Thank you for the time this morning.
No problem. All the best.